listen to the show where your health is your wealth. Thriving is more important than just surviving, and the only thing lost are those unwanted pounds. This is Healthy Talk Radio that helps you get well, stay well, and live well. Phone lines are open, 888-283-7272. That's 888-283-7272. Let's go on. Health and your life. We're here to help. Let's kick it off on the phones. Now, Carla. Let's go with Carla. Hi, Carla.
I've got a problem with my fingernails. They're all starting to split from the top all the way down to the cuticle or break off, and it all started all of a sudden.
Carla, on the nails, if they're starting to split or any kind of brittleness to the nails, a lot of times you got to think iron, and you have to think about minerals. So a lot of the minerals, any of them, maybe it could be something as simple as calcium, magnesium, boron, any of those, but mainly the minerals we have to look at. Now, iron can be a little bit of a tough one, because if you check the blood levels of iron can be fine. You can have plenty of iron in the blood, but you may not have enough of the absorption into the cells, into the tissues. And that's where it becomes a little bit of a challenge. So ferritin is a great marker. It's a great read on a blood test to see how well your body's utilizing the iron into the blood and how it's pulling itself in and, of course, utilizing in the tissues. So it's a great tool to be able to use along the way for that. 888-283-7272. Give us a call or go to the website oncallradio.com. Heart attack in middle age may be a little bit tougher on women. They said that women that survive a heart attack before age 55 tend to face more complications than men do. So women have a little tougher time supporting and handling that than guys do. So again, women are far more likely than men to deal with diabetes. They're also a little bit more likely to deal with depression as well. So they're saying, obviously, that if you're a female, just be cautious, because if you do get in the situation or your body gets stressed enough to where you have a heart attack, the body has a harder time recovering. Men tend to recover from a heart attack and bounce back a little bit easier than women do. It tends to linger a little bit more in some of the side effects, fatigue and whatnot. That's post-heart attack. It can really, really do a number on females. So, again, just a little bit of difference of what's there, but women tend to struggle a little bit more in this area. And this was done, a study was done at the University of California, Los Angeles. 888-283-7272. Lines are open. Give me a call or go to the website. Go to oncallradio.com. Let's go to the phones. Talk with Don. Hi, Don.
24 years old. I've had it bad back in high school, and I was just wondering if there was anything I could do naturally to reduce the pain and inflammation and the pain in my back goes down my legs and sometimes up into my neck.
Really, Don, one of the issues there that you want to look at, and making sure that you stay on top of it with, I would get a good chiropractic physician. And you can do an osteopathic physician, a DO, because they can work on the side of medicine that does manipulation with the spine and that sort of thing, depending on if they're still trained in it. A lot of them kind of abandon that and get into their specialties, but you may find a good family doc that's a DO that can handle a lot of that can be quite helpful. But that's the first and foremost thing you want to look at, because, again, non-surgical is what you want. I mean, no one wants to go in and deal with surgery at any level. So looking at that on a regular basis, having them evaluate it, check it out, have multiple testing done. They can check and see if it's even a situation where you would need it or would not. And that's, of course, the route you want to go. If you can, is the better way to go. That's for sure. And there's all kinds of decompression therapy. There's a lot of different therapies that chiropractic physicians can use, all kinds of techniques to get the body back. I could tell you so many stories of people that had just debilitating back pain that saw chiropractic care and literally turned around. No surgery, doing well, thriving, great mobility. So it's just about making sure that you explore all avenues. It's more than just, for that type of situation, it's more than just anti-inflammatories and pain relievers. You've really got to get to the root cause of why the body's doing that, why the spine is become the way it is, and what needs to be done to correct it. Go with Mike. Hi, Mike. Welcome to the show, my friend. How can I help?
Hey, Doc. I appreciate you taking my call.
Sure.
I've got a question about depression and hormone replacement.
Okay, talk to me.
Well, I'm a 48-year-old, who's generally been in very good health, and probably about a little over a year ago started having more concentration difficulties and irritability. I kind of suspected a little bit in the past, some depression symptoms. Doctor put me on Lexapro, and it worked for a lot of that. My ability to concentrate and my irritability went away, but also, I was getting more and more fatigued, and prior to even the medication, so I think I'm still obviously missing something, and one of my friends had similar symptoms and it suggested having testosterone levels checked, and I was curious what your opinion was on that.
Absolutely. First thing I was going to say to you, and I was going to ask you if you'd had it done. So you haven't had that checked yet, right? Yeah, definitely have that checked. When you have a lot of symptoms, such as the fatigue, and is your sex drive low?
Yes.
Yeah, so there's just not much desire for it. A lot of times, guys, when they hit about 40, there's a slow decline of testosterone, and guys go through what's called andropause, very similar to menopause. So before you go to bed at night, now this is something that with Lexapro, you're still taking Lexapro, right?
Yes.
Yeah, so with Lexapro, you got to be careful with taking 5-HTP because it can interact in certain ways. So I would talk to your doctor about that, and maybe back down on on the Lexapro a little bit, with his recommendation or her recommendation, and then, look at taking about 50 milligrams of 5-HTP before you go to bed at night. That will begin to naturally raise your serotonin levels and increase your omega-3 fatty acids. All right, 888-283-7272. Give us a call. Or go to the website, go to oncallradio.com. What are you struggling with? We want to help you go to the next level, and our lifestyle providers will do that. You just go, of course, to the website. You can find our lifestyle providers information there. We've got Tina in Mississippi and wants to know, she's recently been struggling with hormones, and I've got hot flashes and mood swings. What do you suggest that I do? Well, again, you can just throw it to the change, right? Menopause and premenopause. You can just chalk it up as that. Or I like to really go and dig in a little bit deeper. So go to your primary care physician, get some blood testing done. They maybe do saliva testing to check out some of the labs. Pharmacists really like to have that done. It just offsets some of the ways that they can compound if they need to. But getting that checked out is going to be a key. I would start there and then kind of build. So because the key is, it's not so much just, it's just your hormones. It could be the food you're eating that could be throwing it off. Estrogen levels, progesterone levels could be kind of out of whack by not eating the right kind of foods. I mean, there's a host of reasons why your body's doing what it's doing. But you have to jump in and build a good solid game plan around it and know and be strategic. And there's all kinds of ways, like hot flashes, black and blue cohosh can help, omega-3 fatty acids. Are you getting enough fat, or are you eating too much fat? I mean, there's a lot of variables. Blood testing can help, but getting your hormones checked and then nutritional deficiencies together can make the difference.
Lines are open now. 888-283-7272. Or visit America's Lifestyle Coach online at teamlifestyle.com.
Lines are open, 888-283-7272. Welcome back to the show. Check us out on the web. You go to oncallradio.com. Go to the phones and talk with Tim. Hi, Tim.
Problem that I heard about hypothyroidism, I believe that's the word for hypothyroidism, there it is. And I sing opera, and I hear that it has effects on the voice, but also on like your fatigue and the ability to withstand certain degrees of temperature in the cold. And I feel like I have all these symptoms, and it really scares me because, I just want to know if it might affect my singing later down the road. And so I was just wondering any kind of treatments for it or things that don't require the doctor.
Well, I think pretty much for the most part, you're always going to want to include your doctor at some level, because with the thyroid, you've got to look at blood tests. You want to know what the numbers are. And then if you need medication, that's a possibility. But if not, then there are a lot of things naturally you can do. But you want to have someone that really knows and understands the physiology more than Dr. Google and your local health food store guy or gal. I mean, not that they don't know anything. I mean, Google has everything on there, but you don't want to be the one to make those kind of decisions when you're dealing with the thyroid gland. The thyroid's kind of an important piece of the equation for our metabolism. You don't want to be messing around with that. So it's always good to get that professional opinion and know what the parameters are, and then you can kind of get your own information and build a good solid game plan from there. That's just my 2 cents on it. So the thyroid, again, get some blood test numbers. They can check T3, T4, TSH. Make sure they check the pituitary gland. It's the primary driver. Always want to have that checked. And they can do a basic blood test. Of course, human growth hormone, they can check and see what those levels are, and then build a solid game plan. But that's first and foremost what you want to look at. There are natural ways, but you don't want to abandon anything on the traditional side either, because you have to make sure the body's getting everything that it needs. And with the thyroid, when you got iodine, which is a trace mineral, you got to make sure the body's getting enough. And if we don't get in our food supply, if you're low in iodine, it's going to cause the thyroid not to work as well. Very common, happens all the time, and I would have that checked out on a regular basis, that's for sure. 888-283-7272, that's 888-283-7272. Give us a call or go to the web and go to oncallradio.com. Now, saying a breath test may spot lung cancer, this is really, really cool information. So people may soon be able to learn whether or not they have lung cancer and how bad and what level and stage the cancer may be by breathing into a tube. Researchers have developed a breathalyzer that can detect lung cancer to assess whether it's early or advanced, according to new findings. This was at the Clinical or Society of Oncology in Chicago. The device accurately detected lung cancer in 4 out of 5 cases, and they said the cancer cells not only have a unique smell or signature, you can even discriminate between subtypes and determine the overall disease burden. A new smaller version of the device has since been developed, and you can plug into a computer's USB port. Pretty cool. So this could totally revolutionize lung cancer screening and diagnosis. I agree. This would be humble. If this ends up coming out, that would be strong. University of Colorado Cancer Center and professor at the University of Colorado School of Medicine, Dr. Fred Hirsch, he said that lung cancer is the United States' top cancer killer, in large part because symptoms don't appear until the disease hasn't advanced to the point where it's incurable. So in 2010, 150,000 people in the U.S. died from lung cancer, and including about 87,000 men and 70,000 women, according to the U.S. Centers for Disease Control and Prevention. The potential breath test for lung cancer is certainly exciting, they said. They said, we know that screening people for lung cancer can substantially impact survival, but if we do it cheaply, this will be a go-to test. Lung cancer tumors produce chemicals called volatile organic compounds, which easily evaporate into the air and produce discernible scent profiles. Researchers, for example, have been investigating ways to detect lung cancer from a person's breath. For example, recently a study reported that dogs have been trained to reliably sniff out lung cancer on human breath. So they know it's been there, but the technology hasn't been there. So, of course, now they've developed this technology that literally can take the components out of our breath and break that down and determine exactly what's going on. So the estimated cost for Medicare to CT lung cancer screening and subsequent treatments about $9.3 billion. It's industry. So with 100 million smokers still in the United States, if we could do a one-off screening for lung cancer, it would be incredibly impactful. So if you have lung cancer patients with a median survival rate, typically they're given about 1 year. If you wait 2 or 3 months to see what the response to therapy is, you're losing a lot of time. So they said that this new tube that they're using could cut that down. Also, the screening time and the screening cost can be cut down quite a bit. It's interesting how that works. Powerful new information. Love research. Research is, everybody thinks they're spending a bunch of money on nothing. But so many advances have come through research and through the funding of the different organizations that it's pretty mind-boggling, because so many people have been benefited by the treatments and the therapies that have come down the pipe. 888-283-7272. Give us a call or go to the website, oncallradio.com. You can always check us out there. Of course, don't forget our lifestyle providers or healthcare providers in your area that believe the same way we do. All this nutrition and lifestyle-based care that we talk about, well, we've got coaches and professionals that can help you go to the next level with your health and with your life. Don't forget the new app is out. Check out the iTunes store, and you can listen to the radio show. Just look for On Call Radio. You can look for it, and, of course, listen to the show 24/7. That way it's on your terms and on your time, which is what it's all about. Now, coming up, more information to empower your health, and I've got some more calls. I see you all waiting there. Also got our food of the day we're going to jump in and talk about here shortly. Don't want to miss that. Of course, food either brings health to the body or takes health out of the body. A choice is up to us, no one else. And if you make the right kind of choices, guess what? You get the right kind of cells. The body doesn't know the difference, but we do. So we have to learn how to make the right kind of choices. Also, more fitness tips and ways to drop the weight. You want to do that in a natural way. You don't want to miss what's coming up.